So, first of all, welcome to the Pharmacist Diaries podcast, and thank you for making the time to join me for a conversation today.
And thank you so much, Anisha, for inviting me to your podcast.
Absolutely. I guess we normally start each episode asking why you wanted to become a pharmacist in the first place.
Well, for me, in secondary school, so I liked biology, I liked chemistry. So I just wanted to do something that kind of combined both. But initially, when I started out, I actually wanted to go and study engineering. So I started out wanting to study engineering because I liked physics too. And I was quite good at a subject that we did called technical drawing. So I wanted to become an electrical engineer. I liked the whole idea of everything. But gradually, when I realized that I was shifting towards biology and chemistry mostly, I then started to discuss with my family, like, are there any courses that kind of like combine both where I can merge my love for both? And one of my cousins just mentioned, oh, there's pharmacy. And I was like, okay, I never actually thought about that. So I read on what a pharmacist does, and I tried to look around me, see pharmacy stores, just visit there and see what it was like. And I started to get interested, and gradually towards the final year of my secondary school, I went back to my guardian's counselor because we had guardians counselors that kind of guide you to choose what you want to study in uni. And then I went there and said, I want to become a pharmacist. So I changed what I had written initially. So yeah, that's really the journey to becoming a pharmacist, or deciding to become a pharmacist.
Amazing. I mean, I've checked your LinkedIn profile and you clearly love studying. Yeah, it's definitely one of your passions. Because you've been, ongoing on your educational journey, which is very inspiring. So, I understand that you completed your pharmacy degree in Nigeria. Is that right?
Yep.
How was it there?
So the degree is 5 years. I studied at the University of Lagos in Nigeria. So Lagos is one of the largest cities in Nigeria. And how was it? Yeah, in the first year, we did kind of like general science courses. So we were at the main campus, so the main campus of the University of Lagos, where you take courses with different science students, people in medicine, biochemistry, biology. And then by the second year, you move to the College of Medicine, where you now start to focus on your pharmacy. So that first year was really just trying to understand basic things. So I think it's similar to like if one was doing A levels in the UK and then moving straight to the MPharm. But for us, you have that first year where you do all that science. So by second year, I started the proper pharmacy courses, and yeah, it was quite intense. As we know, studying pharmacy is quite intense. All the different courses, pharmaceutical chemistry, pharmaceutical microbiology, pharmacognosy, and pharmaceutics, and so on. So it was quite interesting, but what I found that is, so I did a bachelor of pharmacy degree, which is kind of different from other countries, but I guess is one of the most common pharmacy degrees. So in the first second year, you focus on those core pharmacy courses, pharmaceutical microbiology, chemistry, pharmacognosy, and pharmaceutics, basically understanding formulation of medicines and all of that. Then by the third, fourth year, you start to move to do more of clinical pharmacy. We do that in the second year, but you start to really do more of clinical pharmacy, pharmacology, understand how drugs work in the body, and move into the clinical setting. And then by the final year, you have a project that you do. And also in the fourth year, did we call it it's almost like an externship. So you spend 6 months in practice. You pick an area that you like, whether it's community, hospital, industry. So we did that for 6 months in the fourth year. And then final year, like I said, you do a project and then you graduate. And so once you're done with your final exams, you move into an internship year. And before the internship year, you have a formal induction ceremony. So you're inducted by the Pharmacy Council of Nigeria, and then it's only after you've done the induction ceremony and you've taken your oath of pharmacy, then you start your internship year. So yeah, that's basically the process. So when I graduated after the internship year, you didn't have to do an exam. Once you got your certificate of experience, I think that's what they call it, you go to the licensing body and then get your official license that yes, you're now a pharmacist. But now they do an exam after the internship year before then they get their license.
Nice. So it's not too different from the UK. I like that you've got this sort of like 6 months in a working environment,
Yeah.
not all the way to the end of the course. So
Mm.
sort of the 3 quarters through the course, you're actually going into a work environment, which is great. Um, I guess what were your passions throughout the course? Where did you kind of see yourself going to work?
Yeah. So when I started, so I came in with that love for biology, chemistry. So I quite enjoyed the pharmaceutical chemistry side of things. But by my third year, I started to shift more towards clinical pharmacy. I like the idea of being directly involved with patient care, understanding how I like pharmacology to understanding how the drugs work in the body, what the body does to the drug, and all of that. And I really just wanted to provide that individualized kind of care. And also because, like you said in the beginning, I like to read. So I actually spend a lot of my time in our library, and I think a lot of people didn't take advantage of the library, but the library has our library then at the University of Lagos College of Medicine had a very good section for pharmacy where there were these textbooks like the Remington's Book of Pharmacy, I think, and different handbooks that were from the UK and all of that. So I would read and read and read and see, oh, so this is how they do it in the UK, because I compare with what we were learning, compare with the kind of experience I had in my 6 months training, and also because in our final year we also did what we call clerkship. We go into the clinics and you work with, you just shadow doctors and just go into different specialties. So reading all of that and seeing that, oh, this is how it's done elsewhere, kind of opened my eyes to the possibilities in pharmacy. And so I started to get really interested in clinical pharmacy because I saw that pharmacists have a chance to really specialize and go deeper into patient care, pick an area that you like, specialize. So I think I started to lean more towards clinical pharmacy. I started to lose interest in the pharmaceutical chemistry, losing interest in the pharmaceutics. So I wasn't really interested in formulation and drug discovery in that sense and all the lab work. Unlike when I first came into the course, so I started to tilt more towards applied kind of applied pharmacy in quotes. I would call it applied healthcare basically, and clinical pharmacy, just working directly with patients. So I started to find out what were the opportunities following my undergraduate, what could I do? And that was when I stumbled on the Masters in Clinical Pharmacy, International Practice and Policy at UCL. That was around my third year. So I'd always had that as my goal. I was going to go through that course.
Amazing. I love that. But when you graduated from pharmacy school, you actually went into a hospital environment and worked as a clinical pharmacist in Nigeria. What was that like for you?
Yes. So after my 5 year pharmacy degree, went into the hospital for my internship year. So that was the Lagos University Teaching Hospital. That was the hospital affiliated with my university. So I basically just went into, I was in the same environment. So the hospital is quite big and serves a lot of people in the city and all of that. But the kind of setting that we work in, or at least the experience there, and I'm sure it's pretty much still the same, is the way pharmacy was there. Um, Unlike where in the UK you are able to go into the wards. I know it's not everywhere in the UK, obviously, that you might have opportunity to go on ward rounds and all of that. But the way the pharmacy was set up there was you're basically in a pharmacy room and you're dispensing the medicines. So patients come and you give them their medicines. And if it's even inpatients, the ward porter brings in the what we call them treatment sheets, what they need, the medicines that they need, and then we look at that, assess for any drug interactions, make sure that the stock is available, and then dispense that. So it was basically just really that and moving between different units. So I moved from the inpatient pharmacy, moved to the outpatient pharmacy, moved to dermatology, oncology. So it was quite nice to go through all those different specialties and kind of get experience of the kind of medicines used, but didn't have the experience to really go into the wards and see the patient. And the kind of setting where I was training is also a low resource setting. Healthcare is out of pocket majorly. Unlike when you have the NHS in the UK and people don't have to worry about paying for their medicines, it's mostly. And if you come into hospital, you get what you need and all of that. But for us in Nigeria, that's still the case. And even then, people have to come in and provide the funds to buy their medicine. So if a patient needs a particular set of medicines and they come to the pharmacy, whether it's outpatient, inpatient, if they don't have enough to cover it, we might have to provide alternatives, or we might not even be able to deliver supply the medicine. So it's dealing with all those decision making around. I think it also helps us to think economically, pharmacoeconomics, think about what is useful for the patient, are they able to afford, and also think about effective medicines, I mean cost effectiveness and all of that. So it's just really different practicing as a pharmacist, especially in the government hospital in Nigeria, because you have to deal with the low resource setting, and then also deal with pharmacy practice not being as developed as it should be. But we're making small progress, yes.
Absolutely. I mean, it's interesting you say that. I worked kind of in Abu Dhabi. So when I was importing drugs from all over the world for emergency medicine, for ambulances, I really struggled to get hold of really simple items like an EpiPen or even inhalers, aspirin. And sometimes the EpiPens would take 6 months to arrive because they would come from the UK and they would get stuck in transit. Maybe a permit wouldn't be released, so they would be stuck at the airport for a really long time. And that was my first experience of really understanding what it was like to work in an environment with supply issue.
Mm,
I think we've been spoiled in the UK up until now, probably because we've had access and availability to most medications. Um, if not everything, the access has been great to the point where you've got a few options for that condition, you know, so you've definitely got a variety of medications you can try for that disease group. But
mhm,
you know, even at this point, we've fallen into the position where we've got an antimicrobial shortage, and everyone is posting all over social media at the moment the empty shelves within pharmacies, and it's absolutely like it's shocking, it's worrying. It's I work in pediatrics, that's really scary to not have access to antibiotic liquids. So I feel like we've taken a step back, but for different reasons. But it is really useful to some regards. Obviously, it's a difficult situation to be in, but from a learning experience, to be exposed to that environment and then have to think outside the box that, okay, we don't have access to these medications. Well, what can we do instead? And maybe people then get into a habit of actually thinking about disease prevention to stop patients from actually getting to the point where they need medications in the first place, which is also really useful. But definitely a challenging situation to be in, and one that no one wants to be dealing with, because at the end of the day, you're not able to treat a patient, or they don't have the money to pay for medications, which is really challenging. And we are very fortunate to have the NHS and access to a lot of healthcare and medications in this country if you live here. I guess going back to the idea of doing your MSc, what was it about this specific MSc? So it was MSc in clinical pharmacy, the international practice and policy. What was it about that course that you were like, oh my goodness, I have to get onto this?
yeah. So when I was looking for clinical pharmacy courses, I was looking at different countries. What stood out for me with the UCL one was, so unlike, I didn't want to just do like a master's in clinical pharmacy. Uh, okay, let me just rephrase that. Um, what stood out for the course for me was the fact that when I looked at the curriculum, when I looked at the different modules, when you have the clinical pharmacy bit, you have the pharmacotherapeutics lectures and all of that, and then you have the bit where you go into practice, so you go into a placement site. But what I also liked was the opportunity to think about international perspectives in health and the different components of the course. So it was the opportunity to design pharmacy services, develop leadership, and the opportunity to carry out a research project. So it stood out for me because it was quite different. So I wasn't just going to be learning the clinical pharmacy, core clinical pharmacy, going into the words. I was also going to learn how to develop clinical pharmacy services, learn about different um, factors that have to do with, I mean, different things I've talked about, public health. So they touched on that and then the policy aspect. So that was what stood out for me because it was a very well-rounded course. So you got the clinical pharmacy bit and then you got the bit where it was developing you to be a change agent, developing your leadership skills, thinking about how to develop pharmacy services. And one of the major modules that I really enjoyed was called International Perspectives in Health. I think they call it the Leadership and Pharmacy Innovation module now. So we had to develop a service. So it was an 8,000 word project, a report, develop a service and think about different things, do a service needs assessment, find out about different models in different countries, think about cost benefits and think about financial analysis. So all those things, just thinking about how do we develop pharmacy services because it course is quite tailored to international pharmacies because they recognize that UK pharmacy is quite well developed and it's not the same in different countries. So the course is quite tailored to help you to go back and develop these pharmacy services in your country and it equips you with all those skills. So that was what stood out for me compared to any other course. And that was why I just wanted to go to UCL to study the course. And of course, because UCL is highly ranked and top pharmacy, top school, and then top school for pharmacy too. So yeah, I wanted to learn from the best in quote.
Yeah, yeah, why not? So after you finished that course, you actually went back home, and you worked in Lagos again in a hospital. Um, were you able to make any change?
Well, it didn't take long for me to realize that, well, I mean, I knew change was not going to be easy because I knew where I was coming from. So I'd done the internship year, and then I didn't talk about after my internship year. So we have this mandatory national service that we have to do in Nigeria. So they call it the National Youth Service Corps. You have to basically serve your country for a year, and they post you to anywhere in the country to go and serve your country, and you work in your area. So I worked in a non-governmental organization, so it was public health. And I think working there helped me to reinforce the fact that I really wanted to do clinical pharmacy because while I worked in different settings and I learned how to work with public health experts and I was working within the HIV and AIDS field, I realized I really missed that opportunity to really provide individualized pharmaceutical care to patients. So it kind of strengthened my resolve to do clinical pharmacy. So then moving back home after my clinical pharmacy um, MSc, obviously had so many ideas and so many things I wanted to do. I had this service proposal I developed as part of my master's and all of that. But change is not so easy. I mean, not change is easy. Everybody knows that. And what I also like was during the MSc, we actually had a class on change management that was delivered by one of the pharmacists who then was a guy at St. Thomas's. And it helped us to really think about when you go back, this is what you're going to face. So we had like a simulation of when you're trying to effect change and how hard it is. So I was prepared for all of that. I knew that this was not going to be easy. So it wasn't easy and I would say I would say I tried to I used my skills, but developing services in that sense I couldn't do at the scale that I would have hoped to do. So I worked initially in a private hospital, it was a specialist hospital, and it was quite the same as the way just as the government hospital where I'd worked, where we were in a pharmacy room and there was not that formal opportunity for pharmacists to have their regular ward round or even go with the ward round with the doctors. But in my own little way, I would try to say I want to get involved, talk to the clinicians and talk about how I can be more involved. Then I also told my line manager, oh, is there an opportunity to follow the doctor to the patients ward and all of that. So sometimes you find out that it feels like you're alone in doing all of that because you've come back with your knowledge or your education. And sometimes you also face pushback because people are thinking, oh, just because you went and studied doesn't mean you're better than us. And obviously, I know that. I'm not trying to say I'm better than you, but maybe we can do things this way. So change is not easy. So I wouldn't say it was easy at all. And then after I worked 6 months in that private hospital, I moved to a government hospital. So it's a specialist hospital specialized in orthopedics. And that was quite different compared to where I did my internship here because the National Orthopedic Hospital in Lagos is quite good. The pharmacy service there is quite good compared to any other place I worked in because they have a very good relationship with the clinicians, with the the multidisciplinary team. And so I went on weekly ward rounds with the doctors, physiotherapists, social workers, nurses, and I went through different specialties. So different specialties, bones and plastics, spinal units, and all of that. And it was quite interesting because I actually could do things that I hoped I could do there in terms of be more involved with the patient care, be able to make interventions, recommend things while on the ward round. And I also developed a good relationship with some of the doctors because they were able to recognize that this is the pharmacist on our round and these are the things that she has been doing and the kind of value she has been adding and all of that. But in terms of then, so I had out sometimes I'll share thoughts with some people that how about we had okay, these are the orthopedic hospital. We know our patients are on a lot of anticoagulants. Oh, they did I came across this anticoagulant clinic in the UK where I did my masters and all of that. They'll be like, oh no, that's not gonna work here. And someone told me that's not gonna work here. Like, oh, I don't think we have time for that. So it's just you realize that oh, there's only so much I can do and sometimes it can be really sad because you
Yeah,
know what you can do but you can't do it.
you can feel quite defeated. And also, when you've done a course like that, you're very enthusiastic and very motivated, and you really want to use that knowledge because you've gone abroad to learn. And you're like, I can do this. Like, I've learned so much. It's time for me to implement this into practice. But then when you get home, it's a different case because it just depends on maybe the environment that you're in and the people that you're surrounded by and whether or not they accept change. It may be that they don't have the resources at this time to allow you to implement all these exciting projects that you want to implement, which will impact patient care. But their priorities just don't align with yours in that moment. And it does take a really long time. So it's kind of, to some extent, you have to stick it out, don't you? You have to stay in the job, stick it
Yeah,
out for a long time,
yeah.
and just keep like persevering, which is really challenging. And you can feel very deflated when things don't move in the direction that you know they should and you want them to. So it's not easy. It's definitely not easy. And working, like when I worked internationally, I was very frustrated because I felt like I was in an environment where I was about 20 years behind the UK. And I was like, there's quite a few small steps that we can make to move forward, which I feel like I'm not asking for that much, but it will have quite a large impact. Um, but the people that I'm dealing with are very reluctant to utilize that change. So I completely understand where you're coming from. And in that moment, I felt quite frustrated. But once I left Abu Dhabi and I came back to the UK, I then realized, and I became a little bit more mature as a pharmacist because I was still very early in my career at that point. Similar to you, you were trying to make all these big changes quite early in your career,
Mhm.
that then you realize actually, okay, this is a long game. There's lots of things that I can do and it will happen over time. And I need to utilize this course as a stepping stone in terms of my knowledge, in terms of gaining the experience to then put those things into practice later down the line. I'm sure that you've utilized a lot of that knowledge throughout the last few years, step by step, but it's just not had as big and bold a
Yeah,
statement as you kind of wanted when you kind of returned home.
yeah.
But amazing that you've done it, and you haven't stopped studying. So I won't stop there. That wasn't it. You continued on your journey in education. So from there, you decided to do a postgraduate certificate in research methods, and this is obviously with Glasgow. So maybe you can tell us a little bit about that transition from you completed the MSc, you went back home to Nigeria, you were working. What then motivated you and inspired you to then go into the research side of pharmacy?
Yeah. So while working, previously, I mean, during my undergrad, so I had that 6 months work experience and all of that. So throughout all that period, the setting I worked within we're also dealing with those issues with supply and all of that I talked about, but you're also dealing with medicines regulations are not as strict as you would expect in a country like the UK. So things like antibiotics, for example, over the counter, and it was just really frustrating, especially because I knew there's antimicrobial resistance to think about. So it wasn't just even for antibiotics, it's just that general widespread access to medicines that you know should be prescription only medicines, and especially now going for my masters and seeing things that were easily available in back home, they're not as available in the UK just over the counter, and the way they are basically prescribed and dispensed within the clinical setting. So when I went back and I was working, because I like to always develop myself, and I had been exposed to specialist clinical pharmacists in the UK. So, like I said, people leading diabetes clinics, anticoagulant clinics, and I thought to myself, how about I'm so interested in how can we improve the use of antibiotics, antimicrobial stewardship. Why don't I try to find a way to specialize. So at least in that way, if I improve my skill in that area, maybe I'll be able to add value gradually in this certain way I'm working, and maybe people will start to see some of the things I'm doing and how they're impacting. Because around that period in the hospital where I was working, they were starting to talk about building an antimicrobial stewardship committee. So I knew, oh, that's an area I'm interested in. So we have this thing we call the West African Postgraduate College of Pharmacy. So I was going to develop my own specialism training plan because there was no formal training in that sense. So what I did was I said, okay, so this West Africa Postgraduate College of Pharmacy training basically is a 5-year training. You do a first year, they call it the primary year, you pass an exam, and then the second and third year you undergo different courses. You pick a faculty, and then by the third, fourth, and fifth year, you do a residency in an area you're interested in. So the program is not that well developed. It's not like for example, the residencies they do in the US, the pharmacists do the PGY one and twos. But that's the idea behind that program. So I was like, okay, I'll use that program. And then I found this, I think it's IDSA, Infectious Disease Society of America. I think they have an antimicrobial stewardship specialist program that you can do if you're based internationally and find a way to get certified with them. So I had that planned out how I was going to do it and just gradually develop myself, build my expertise in that sense. So I actually enrolled for that West Africa Postgraduate College Pharmacy program. I started it, I passed the first year. But sitting in the classes and just all of that, I was like, no, I'm sorry, this is not good enough for me. And it just didn't make sense how I was going to, because like I said, it was a plan I was developing myself. There was no formal program. So I was like, how am I going to do this? I'm just overwhelmed. So, you're sitting in one spot and you're frustrated. You know what you want to do, but there are no structures in place to do that. And I started to really think about how do I make sense of all of this. It was then I started thinking, okay, how about I try to do research in this area, like try and do small projects and all of that. But then again, there's just so many barriers. You're facing the things we've already discussed. And there's also hierarchy, like you said, early in my career. So it almost seems like you're doing too much or you're trying to do things that people have not done because it's not yet your turn, which really didn't make sense to me. So I decided to lean more towards thinking about how can I do research, and then it just came to me that I think I might have to actually do a PhD because I didn't want to do a PhD. I was going to stop at my master's because I felt there was no need for me to do a PhD. I don't have to have a PhD to do research, was why my thinking then. Because if I just have the right structure in place, the data is available. Find a way to make the data available and neat, and find a way to develop myself and just start to make an impact. Because I'd seen, we do a lot of QI projects in the UK. A lot of audits and all of that. And I saw that my project was a service evaluation for my MSc. My colleagues did audits. And all of that. So I saw, I knew what I could do. I had the skills. So it made more sense for me to just go and do a PhD because I didn't have that opportunity to train in that sense and do all of that. And because you can't do anything on your own, you need that backing. There has to be someone that even believes in your vision, and there have to be people that are also trained that can mentor you. But when you don't have those kind of mentors and don't have that structure, so I didn't want to do a PhD, but I realized that that was what I had to do to really feel fulfilled. So I really did not want to leave because, like you said, playing the long game, I believe that I can make a change. But at the same time, if you're waiting to play the long game, but you're not happy, how do you balance that? So I wasn't happy, and I also wanted to do this. So I just said, you know what, let me start looking for PhD programs. And I'm not going to do my PhD in Nigeria because I've already been exposed to how um, research is done in the UK and pharmacy services research and all of that. So I told about three people that I want to do a PhD who were studying for their PhD in UCL, and one of them had completed. So I just told them, even though I was scared, I wasn't sure at first, but I told them because I wanted to kind of build accountability. So they would keep asking me about it, like, oh, you said, have you checked? And so they will send me links or tell me to check there's this jobs.ac.uk, find a phd.com. And so I gradually started to search. Even in between searching, I was still trying to explore that program I was doing, still trying to do the two things. But even though I was not sure, like I said, I was still not sure. But the day I stumbled on the project that I'm doing now, when I saw it, I was like, okay, this one was made for me. I better grab it now. I'm not letting it go because this is like serendipity. This is just for me. And I was too excited about it because when I saw it, I was like, it was the project was called Feasibility and Acceptability of Antimicrobial Stewardship Hospital, Antimicrobial Stewardship Interventions in Healthcare Hospitals. So what I did, because I was so excited, I just sent an email to the supervisor saying, "Oh, I'm a pharmacist. Blah, blah, I did my MSc in UCL. Blah 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 blah. I'm based in Nigeria. I'm interested in this. Blah blah." I just sent the email. I said, "Oh, I attached my CV." I didn't even attach anything because I was actually going to work that day when I saw that. So immediately I got to work and I was about to resume my duties for that day. So I just quickly sent the email. Forgetting, I thought I had attached what I attached, and then I went on about my duties, dispensing and counseling. As when I came back in the afternoon to check my phone and saw that the supervisor had responded, I was like, okay. And then, but she said, oh, you didn't attach anything. I was like, oh, I'm so sorry. And then she said, oh, I think you'll be suitable for this PhD. So she encouraged me to apply for the PhD. And that's where I am today. Although I did have concerns when I was applying because I wasn't applying to a pharmacy school and I wanted to like kind of retain just but I spoke to those people who had especially one of them who had told about my intention to apply for PhD, and she had encouraged me that it didn't really matter because it would give me an opportunity to work in a multidisciplinary team and work with different healthcare professionals and to make my PhD more robust. So I just went with it and that's where I am today.
Well,
So
I mean,
I was
I you've been very bold in terms of kind of knowing what you like, knowing what you want to do, and you can see the big vision.
yeah,
You want to see that change, and you want to see, and you're loyal also to Nigeria in terms of wanting to help them to improve what they've got in terms of pharmacy and healthcare, antimicrobial stewardship, like regulations for medicines. You can see the big picture. And I guess as a young, relatively newly qualified pharmacist, you went in there with the big bang, like, let's do this. But obviously, going into that course, which was a great idea, you quickly realized that actually you're a lone ranger and you need to take a step back and figure out what exactly it is that you need to learn, such as maybe completing a PhD to gain that knowledge, gain that experience, really dive deep into a specific topic. So you can then say, well, actually, yes, I've spent the last 5 to 6 years studying this topic and I have all the knowledge, all the tools, all of this new kind of experience with research methods and data analysis, and I can then put in whatever changes that need to be done on a higher level in terms of potentially reaching out to the government or
yeah,
going up to kind of executive level in a hospital and saying, this is what we need to do. Look at my data. I've done this research and this is the change that we would see. So you're kind of giving yourself that foundation of knowledge to then kind of go back home and make those changes, which is amazing. One thing I kind of wanted to highlight is that even though you've been doing so much already, and your studying is definitely something that kind of was one of the main highlights in terms of what I saw on LinkedIn, and you've been really dedicated to like education and learning, but you've also kind of taken on a lot of volunteer roles on the side. So you've been involved with, because you like antimicrobial stewardship, you obviously found the Commonwealth Pharmacists Association, which is an amazing organization. I've interviewed a couple of pharmacists from there, and obviously being an antimicrobial resistance like intern globally, that will have definitely kind of compounded your knowledge and also got you in touch with lots of people who are like-minded, who are on that same mission, in terms of improving stewardship. And then you also have been involved with the International Pharmaceutical Federation, FIP. Maybe you can tell us a little bit about both of those organizations, and what you've been doing to get involved.
Yeah. So for FIP, I've always heard about FIP during my pharmacy school in Nigeria, because FIP has member organizations, of which the Pharmaceutical Society of Nigeria is one of them. So um going into clinical settings, or like when I did my internship, you'd see some FIP booklets or things, and I'll just read it. I'll be like, what do these people do? And then I'll go on their websites, and it looked really good, because I really wanted to, like, I wanted to broaden my like horizon, like interact with pharmacists more internationally, and that was why I went for my masters. So getting involved with FIP, when I decided to become a member at the end of 2016, just when I finished my masters. And I my master's project, actually, when I was done with it, I decided, okay, let me submit an abstract of my master's project to the FIP conference. I just did that. I didn't tell anybody about it. I'd never written an abstract before, and I submitted and it got selected, and I had the opportunity to travel for the conference. And when I went for the conference was where I saw, like, pharmacists from all over the world, and I'm like, wow, this is like a festival of pharmacy. And I started to really get interested, and then I got involved with the Young Pharmacists group. Now it's called the Early Career Pharmaceutical Group. So I attended their business meetings at that conference in South Korea. And when I attended that business meeting, I was like, these people are they have the same interests as me. Like, they're doing so many big things. Like, how do I become part of these people? Like, I can do these things. And so I just decided, okay, I'll keep in touch with a few people I had met there, and just try and see how I could get involved. So then YPG wasn't as big as it is now, because then they had just a 3-man steering committee. They had a chair, they had a project coordinator, and they had a public relations officer. So now they have what they call subcommittees where people can get involved. That was launched in 2018. So at that business meeting that I attended in 2017, they had elected a new exco. And so I knew that opportunity was going to come up, because they were going to increase more opportunities. So by 2018, I decided to apply to join one of the subcommittees as a newsletter coordinator. And I remember joining with one of my friends who is now a staff in FIP, and we both applied at the same time. We're discussing with each other, oh, should we apply? Should we apply? It's like, oh, just give it a go. Let's give it a go. Let's see what comes out of it. And so that was how it started. I realized that it's when you sometimes you can look at something so big like that and so interesting, and you can just be looking at the sidelines and you just admire it. But the minute you give yourself permission to go in and just get involved, it's like a ripple effect. Things just start to happen. So the minute I was into like that bubble and finally joined the subcommittee, more I started to develop relationships with people. When you do good work in that sense, and people, you kind of build a reputation. People know that this person does this person does that, and you start to build relationship, and you start to see what is possible for you to achieve. Because when you interact with people, you say, okay, I think I'm as smart as this person, so I probably can do what they're doing. And so by the next year, 2019, I decided to continue on the subcommittee, applied for a new subcommittee role. And then I also think it's very important to have peer mentors, people, like I said, people that you together, you're just doing things together, and you realize, okay, I can do this, person can do this, I can do this. And so by 2020, I decided 2019, end of 2019, I decided to become an ESCO member. So one of the people I had admired in 2017, and that was a big step for me because I'd never done any kind of leadership stuff in my life. And so it was just really just taking each step. I really have like a big plan, but each step I took, an opportunity came, opportunities that I didn't know existed, but it's because I took a step. So that's how I've kind of gotten involved in FIP in that sense, and just gradually did different things, and different opportunities opened up along the way. And because I just have a passion for global pharmacy, I like really interacting with pharmacists from different countries. I like just adding value and just building my skills. I've learned a lot about how to work with people, work in teams, learned a lot about global pharmacy. I had the opportunity to join the first FIP delegation to the World Health Assembly in Geneva, WHO. So different opportunities have come up, and I just really um enjoyed being involved as a member of FIP in different capacity.
Absolutely. And it just highlights the power of networking. It highlights the power of finding what you're passionate about and then getting involved with like effectively your tribe. You've found an organization that fits all your passions, and you've got so many like-minded people on a very similar journey, or ones that are on a different journey but of still, you know, interest to you. And
Yeah,
together, as friends, as colleagues, as pharmacists, as scientists, you kind of see the bigger picture and where everybody kind of fits in, and it helps you to create more ideas, doesn't it? You
yeah,
start thinking, oh well, so and so's doing this, you know, in another country. How could that fit in with Nigeria? Or what can I do to get involved to support that from a global perspective? Which is one of, I guess, the most exciting parts of also being involved with FIP, is that because it's a global organization, you're interacting with people from all over the world.
mhm,
And it's really exciting to be part of that. And I can see where one thing has led to another, because as soon as you meet one more person, you're like, oh my God, that sounds amazing. Let me get involved. How can I, you know, what can I do? What can I do to support? And by, you know, 3 years on, you're like part of 3 committees, and you're in, you know, 5 groups, and you're supporting people from all over the world. I also saw on your LinkedIn profile that you got a 2022 FIP Wise Rising Star in Pharmaceutical Sciences. What's that about?
yeah. That came in June this year. So that was FIP recognizing people who had made an oh rising stars, basically, who had kind of made an impact or have achievements in pharmacy, just to advance pharmaceutical sciences and education. So they it basically just recognized 20 women from 14 different countries, and I was one of those that was recognized based on, I guess, all my work with FIP, CPA, and different things along the way.
You've definitely grown as a pharmacist from the kind of start of your journey, and you've like from trying to do things on your own,
Yeah.
you've really developed a huge network, and things have really developed and changed for you. And it's, you know, it seems like you've got a very open and kind of growth mindset to seeing what's out there and utilizing all those skills and experiences and people to kind of, again, like we said, stepping stones towards the bigger picture.
Mm.
When is your, like, how long have you been doing your PhD for, and when is that coming to an end?
Yeah, I've been doing that for 4 years. And before I answer that, I just wanted to add to what I said about what we talked about previously with FIP and CPA, because for CPA it's almost like a similar kind of story. Because always seen Commonwealth Pharmacists Association. I didn't really know what they do, but I knew that the Commonwealth is made up of 53 countries. So obviously they're focusing on the UK and these other countries, and Nigeria is included. So it was at the Glasgow. I started my PhD in 2018. So I'm in Glasgow now, and the 2018 FIP conference was actually in Glasgow. So I just went there because I just commenced my PhD, and it was at that conference that I CPA had a poster, and I met two of their officers who I just went to because they had a poster on antimicrobial stewardship, and I just said, you know what? this is my topic that I'm interested in. And I just went and I introduced myself to them, saying, "Oh, I was just starting a PhD and I'm interested in this topic and I'm interested in the work that they do and I just want to connect with them." And they gave me their business cards and said, "Oh, you can reach out anytime." So after the conference, like a week later, I reached out to one of them and just said, "Oh, it was nice to meet you," and all of that. And from just doing that, then she shared an opportunity with me and I volunteered with them for about 6 months before they then told me, "Oh, there's this opportunity to become a global AMR intern," because they were starting the Commonwealth Pharmacists for Antimicrobial Stewardship program. So it just building up on what I said before, because I took that first step, the opportunities just kept coming and I was able to be involved in something that I really wanted to be involved in. Because remember, I'm passionate about this AMS thing and I'm passionate about how can we improve it in Nigeria. And they were doing a project that focuses on Africa. So that was an opportunity for me to try and make a little impact in that sense. So that's just it. So moving on to the PhD now. So it kind of links to all my work because my page is focused on antimicrobial stewardship. So I've been doing that for 4 years. And I know somebody's probably thinking, why am I not done yet? But COVID affected a lot of things. I lost basically 9 months, because for 9 months I couldn't do much on my PhD because my work is looking at improving the use of antibiotics in acute care hospitals in Scotland. So to do my work, I needed to have access to NHS staff, and they just were not available. COVID was more of a priority for them, so my work stalled during that period. But thankfully, I was able to pick that up back at the end of September, between September and March 2020, September 2020 to March 2021, and start my data collection in March 2021, which was my third year. So I lost a bit of time, but I can say thankfully I'm coming just to the end of it and I'll close to submission, writing up my thesis and all of that. So yeah, been doing that for that long.
Well, I wish you all the best. It's, you're nearly there. And it won't be long before your next project or your next educational endeavor will show up on LinkedIn, I'm sure. It's very exciting. You've done a lot, and you should be proud of all the achievements and that kind of motivation from the beginning, the very, very beginning of your career as a pharmacist. And I love it. A lot of people will be very inspired by your story and your journey into pharmacy. And even though you probably feel like you're not necessarily acting as a pharmacist at the moment because you're doing your PhD, and you even said to me, "Am I really eligible to come onto the podcast?" Yes, of course you are. It's amazing, like all of these things that you're doing. It's super inspiring for young people who are out there and people who are afraid of potentially going into a PhD. It's quite a scary kind of decision to make for some people because it does take a long time. You do feel like you take a step back from pharmacy and you've worked really, really hard to get to the point of going into a community pharmacy or a hospital and being very clinical, and then you potentially step away from that. Financially, it's very challenging, which can be difficult for people to make that decision. But you've been doing it, and like, look at all these opportunities that have come from making those stepping stones. And I love that you are not afraid of asking and connecting and networking with people, because a lot of those opportunities wouldn't have arisen unless you had been bold enough to send that email or introduce yourself at a conference or take that business card. And that's really a valid point to take home for the people who are listening in. Um, Before we sign off, I know that you have a YouTube channel and there's lots of information about doing your PhD. What's the name of your channel? Can you tell people?
Yeah, my channel is actually called Ayodeji Matuluko, so my first name and my last name. So just to make it easy for people to search.
Yeah, no, I'll put it into the show notes so people will be able to click the link, and also your LinkedIn profile. Thank you so much for your time today, and I really
Thank you so much.
appreciate you coming onto the podcast and sharing your journey. And it's really exciting to see all of the achievements that you've done over the last few years, and it'll be exciting to see what comes for you in the future.
Thank you so much for inviting me to your podcast. being in
Absolutely.